Coin 6 wants to know who in Oregon will be next to get the vaccine. The Oregon Health Authority's vaccine advisory has now made its recommendations on who will be included and who will have to wait.
Let's check in now with our Lindsay Nadrich, who's been staying right on top of this issue for all of us. And Lindsay, what happened today?
Well, the Vaccine Advisory Committee is facing a January 31st deadline to get a recommendation to the governor's office. So after a lot of discussion, they decided there are several groups that should get the vaccine before the general public.
We always wait to the really last minute to agree on something. And I'm feeling really frustrated with that.
Time almost ran out on today's meeting without a final decision on a recommendation.
We all have our cultures. I've said very little about Black people. The Black people that are in this group, we've said very little. Other people have spoken for us who are not Black people, but we haven't said anything because my goal is just for us to put something in agreement.
Most of the discussion centered on how to address health inequities and how structural racism has created systems and conditions that put Black, Indigenous, people of color, and tribal communities at a higher risk for adverse health outcomes. The group initially wanted BIPOC communities to be vaccinated first. But State Public Health Director Rachel Banks said vaccines can't be rolled out that way.
We're not able to prioritize services or make decisions based on services solely on somebody's race or ethnicity.
So the committee changed its recommendation to adults 16 to 64 with underlying health conditions, frontline workers who've been working through the pandemic, adults and youth in custody who are 16 and older, and people living in low income and congregate senior housing. Then, after all of those groups, people who live in multi-generational households, followed by the general public.
I also want to be transparent in saying there will be decisions made if we continue to have, 50,000 or 30,000 new first doses a week and an eligibility population that's very, very wide.
Well, you may have noticed the committee's recommendation on who to vaccinate next covers roughly 1 million people. And right now, the state doesn't even have enough vaccine doses to vaccinate those currently eligible in the state. So OHA said they're going to have to take this recommendation and essentially narrow it down further. Reporting live, I'm Lindsay Nadrich, KOIN 6 News.
Lindsay, thank you.